Hi, my name is Nicole Vipperman and this is my NG placement video. I would follow all GPSP, do the 2 patient identifiers, assess for allergies, verify my orders, correct assessment of the face and the nasal cavity, and I would explain the procedure to my patient. Once my patient understood the procedure, I would begin by measuring my NG tube. I would go from the end of his nose to the tip of his ear down to a xiphoid process. I would mark it. Okay. Then I'm going to perform hand hygiene, don gloves, get me some tape ready. I would lubricate the tube 2 to 4 inches into the lubrication. Once that's done, I would have the patient tip their head back, and I would advance. We're going to go through the right nostril until I feel the pharynx. Once I feel the pharynx, I'm going to ask the patient to go chin to chest. Then I would give the patient something to drink. And while they're drinking, I would say swallow, swallow, swallow. I would advance the tube. If there were any signs or symptoms of distress while I was advancing the tube, I would discontinue this procedure. Okay, once I have the tube in all the way to the mark, I'm going to secure it loosely to his face. Okay. I would call X-ray and have X-ray confirm the placement. Then I would also confirm by pH. So I would take my syringe and I would aspirate a little gastric fluid. It's going to be yellowish brown, green, bile, gastric fluids. I'm going to cap it back. Then I'm going to put it on my pH paper to test the pH. The pH is around a 4.5, which means we've got gastric acid. Okay, now I'm going to measure the length of the exposed tube. Okay, it's about 42. Now I'm going to secure the line. Okay, and I'm going to secure it again, and I'm going to secure it again. Okay, this is also, the tube does not come out of the nostril. Now I'm going to measure the tube again. Again, it's about 42. So I'm going to mark it. Right there. Okay. I'm going to place this part of the tube onto the patient. I would secure it with tape or a safety pin. I would make sure that it's above the stomach, fully secured. I would cap it or run it to suction per orders. Okay, once that is there and everything's capped, I would assess the patient. Are you feeling okay?
I'm fine.
Everything okay?
Yep.
Great, wonderful. All right, then I would take off my gloves, perform hand hygiene, report and record, and come back in and assess the patient in about 10 or 15 minutes. Thank you.